Welcome to the Future of Health podcast, produced by Health Further. To learn more about Health Further and stay up to date on innovation, care moving out of hospitals, and the rise of the consumer, head over to healthfurther.com/join and become part of our community. Enjoy the conversation.
All right, so David Schiffer and Marcus Whitney here from Health Further to talk about some updates in trends that we're seeing in healthcare today. And the two things that I want to talk about, Marcus, are these themes around the rise of the consumer that we're looking at, and then the value-based care initiatives going on and some of the updates on how that's moving along. And so I want to start with that second one with value-based care. And we've seen some data coming out over the last week or so showing that value-based arrangements are not moving as quickly as people thought they would. They're not growing as much. And so there's been a survey of healthcare executives saying that, first of all, over half, around 61% of executives think that their organizations are below average, which is kind of funny when you think about the math, at managing these contracts. And everybody knows they need them, but they're scared to take on more risk-based contracts because they're risky. And so I just want to talk about that for a minute, that we've been hearing so much for so many years about how value-based care is going to change everything. And this was the year, or these were the couple of years where it was finally going to happen. And yet we see studies like this, and then we see information coming out that really only 3-4% of transactions in healthcare are fully value-based population health initiatives. And so it's just not where people wanted them to be in 2019. So talk about what you see going on with that.
Yeah, I mean, I think you've already said it. The data bears out that the hype cycle that was going on around value-based care is not really playing out. I do think it is very closely connected to the rise of the consumer issue, right? Because value-based care is a model to try to manage the costs in the current paradigm, which continues to be business to business, payer and provider sort of, covering all the costs and the economic burden for the individual, right? And a true consumer model would be price transparency and marketplace dynamics, right? Where you have choice and you have ways to measure quality and other things like that. And when was the last time you bought something in a value-based model?
We don't have time for me to figure that out.
Right. Okay. Yeah.
So
that
answer is no.
Yeah. So that's the point, right? Is that value-based care is not really the rise of the consumer. Value-based care is a strategy for the existing paradigm of payer and provider.
Different version of B2B. Different negotiations between payer and provider.
Correct. And so the speed with which that's being adopted has everything to do with the players in that paradigm, right? You know what I mean? And on both sides, and their willingness to do it, and the structures and the risk and their ability to even operate under that model, their tools, the people they have. I mean, it's that's really what it is. And so it's not moving along very quickly. Medicare Advantage is far and away the leader in terms of a model and a structure with which you can do value-based care. I mean that's just where we are.
Do you think Medicare Advantage is going to, push
save
the private,
save the world?
Yeah.
No.
Okay.
No. I mean, I think innovation is good, right? And so I think not just sitting around twiddling your thumbs and saying, putting your head in the ground around obviously the rising costs and the contribution to the deficit in the country and the mismatch between costs and outcomes and all those types of things. Yes, we need innovation. We need to be looking at different models. I'm totally up for exploring value-based care. There are case studies out there that show that it does lower the overall cost of care, and so I think that's great. You know what I mean? And I want to see more innovation in that space. But I also want to see more innovation in just the pure, consumerization of healthcare space too, right? I'm probably a little more excited about that than I am about the value-based care stuff. Mm-hmm. But I can get excited about the value-based care stuff as well.
Okay. So let's talk about the rise of the consumer then. And this is actually what initiated the thought to have this conversation, because I think we've been seeing, so when we sat down and sort of mapped out the healthcare industry last fall into the beginning of 2019, we had looked at the rise of the consumer and a bunch of different pieces underneath that as being one of the key trends driving change in healthcare, maybe not even driving it so much as being kind of hot on the heels of the immediate business concerns. And so we said, look, this is important to be thinking about. It's still a little ways off, and yet in the first quarter of 2019, it feels like it's blowing up. So my first question is, it's a question for me that I want answered.
Okay.
Is it moving faster than we thought it was when we started looking this back last fall, or is that just sort of an attention bias on our part?
Well, maybe a little bit of both, somewhere in the middle. I think my personal bias is, it's a bad idea to bet against the internet, and it's a bad idea to bet against Amazon, right? So I don't do those things, right? I think internet interventions into sort of middlemen come faster than we ever think they're going to come. So long as HSAs continue to grow and self-insured employers continue to be more and more dissatisfied and continue to get more interested in how they can take more control over their healthcare spend, those are the two big trends for me that are driving what I think we're seeing when we're looking at Amazon, Apple, and Alphabet all getting much more engaged in this space. I think it's going to, it just makes sense, right? I mean, like, if you're a healthcare insider, then, you can come up with all the wonky reasons of, our industry is different from other industries, blah, 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 all that stuff. But if you're anyone else and you're just looking at the size of this market and you're looking at the power of these companies and you're looking at market cap of the leaders of the tech industry versus the leaders of the healthcare industry, it's like, it's not even a question about where this is ultimately going to go. So it's about timing, right? It's about timing and what's going to happen and how it's going to unfold. But I don't see how you could possibly bet against the tech titans in this. Healthcare is different because we've kept it different for so long, and because that's the way it's always been. But that's changing.
That's changing, right?
From a regulatory perspective, it's clearly changing. Clearly, we're moving away from that. Yeah. Right. We're clearly
and it's not
moving
that it can or should be different. It is.
Right.
But we're asking why is, like, let's do what should and can be done.
Right. Right.
So the last piece of this then, so that's kind of the rise of the consumer in general and looking at the tech titans. The other part of that, or one of the other parts of that, is sort of integrated care and what that means for individuals. Because again, in the rest of our lives, we operate sort of as this, holistic unit, this person, and we never make decisions in a vacuum. And so this is where social determinants start coming into play. That's probably the most obvious area, but we're starting to see a lot more deals. And again, maybe it's just that I'm paying more attention to them, but it does seem like the rate of increase in some of these unconventional deals is really ticking up. So just this week, there's something coming out about Anthem getting a grant to cover legal services for Medicaid patients, right? Because the idea is legal problems are often associated with a barrier to getting health care.
Yeah.
And we're seeing this in terms of food. The example we love around here is Geisinger's Fresh Food Pharmacy. Mm-hmm. We're seeing transportation, supplemental benefits through Medicare Advantage.
Yeah.
So what is that? What's your take on what you've seen from that over the last couple of months?
I mean, so I feel like I'm hearing social determinants of health 10 times a day now. Yeah. Look. I
guess that's the other part. Is it becoming a buzzword?
Well, it's becoming something that's oversimplifying things, right? Okay. And so, I'm not saying that it's not good to look at that pie chart and understand that someone's socioeconomic situation and genomics are not key to their health outcomes, versus looking at what the healthcare system itself, that 20% sliver that we like to keep poking at, right? Yeah. I think that's great, but then what's the next layer down from that? And it's urban versus rural. It's millennial versus baby boomer. It's black versus white. It's what I mean. It's male versus female. Yep. It's it gets real complicated real quick. Right? Once you go down a layer and start saying, okay, well, what does that actually mean? Mm-hmm. You know what I mean?
This is the multidimensional matrices that programmers develop that we only can fit 3, maybe 4 dimensions in our head, but when healthcare is 40 dimensions or 100 dimensions.
Yeah, and by the way, this is why technology is going to win. By the way, right?
Because this is why Amazon has a leg up, because they understand how to...
And Alphabet and Apple.
Yeah.
Right? I mean, this is why. Because the mobile phone is going to be the most ubiquitous touch point that we're going to be able to have. The wearables are becoming FDA-approved medical devices, and they're better at understanding complexity. They're better at it.
Yeah,
right?
Case in point is the Kaiser article that came out again earlier this week, Death by 1,000 Clicks, looking at let's call it what it is, the train wreck that EHRs have been. And that's the healthcare industry trying to build a cross-functional piece of technology under sort of a weird incentive program, and then you compare that to the iPhone, a consumer-driven product, and the difference in how those two things operate.
Yeah. The healthcare industry today is a B2B industry that has never had to deal with the concerns of a B2C industry. And as healthcare becomes more B2C, that simple fact is going to be the most difficult thing for the leaders of the incumbent legacy industry to overcome, right? Is their complete lack of capabilities, experience, and maybe even belief, right? I mean, like you can talk to, 10 different CEOs, and one will tell you marketing is everything, and another one will tell you marketing is nothing, right? And who's right? I don't know who's right, but I can tell you there are different rules of the road for B2B versus B2C.
Absolutely.
And as this thing gets more B2C, the B2B leaders are getting more away from shore. You know what I mean? They're getting into deep waters that they don't know how to swim in. And so yeah, look, I think that the generational shift is the inevitable, undisputed one, right? That's where millennials are going to drive change. Everyone knows millennials are going to drive change, and no one's going to really sort of dispute that, right? Everyone has different opinions about how long that's going to take. For me, them being the number one generation in the labor force it sort of says it's already here, yeah. Right? It sort of says it's already here. So now it's just sort of a matter of speed. It's a matter of speed, and it's also a matter of how quickly are the regulatory changes going to come in place that lower the barriers for competition. Yeah. And free market, entry, right? It's those things. The accelerant is going to be the self-insured employers, right? How much do they start behaving like activists and taking over control of their employees and that spend? And
we're hearing as we go out and talk to people in the industry that people are looking at direct contracting with not even huge employers like Amazon, but small to mid-sized employers too. Everybody wants to get a handle on this.
I mean, it's happening. There's enough tools out here now, right? That if you're a self-insured employer and you really want to go to town with this yourself, we've been investing in digital health over the last 5 years, like significantly, right? So it's not just about Amazon, Apple, Alphabet. I mean, there's a bunch of technology companies out here right now that can really help you to take control of that, to run your own narrow networks, to like manage your risk, to get access to your claims and run analytics against it. I mean, it's here. You know what I mean? The question is, do these companies want to hire someone from the healthcare industry to come in and help them to manage that, right? But I mean, the tools are definitely there now. So, yeah, look, I mean, I think change does take time. It will take time. I'm not here saying that the payers are going to all die and that the providers are going to all die, but it's fairly clear
something's got to give.
Something's got to give. Something's got to give, and it's giving. It's giving right now,
and possibly faster than we even thought.
Yeah. That's actually my biggest worry about the value-based care bit. Is I don't think the value-based care bit is going to move as quickly as the consumerism piece. And so it's not to say that the value-based care thing isn't real and isn't something to pay attention to, but it can be a red herring. It can be a misleading data point if you're trying to make value-based care the measuring stick for change in healthcare.
Yeah.
Right.
As opposed to a conversation that we had in this office 2 weeks ago with a few team members, all of whom were millennials, saying, we don't get the healthcare industry. We don't understand how it operates, and it's not pleasant to interact with, and they're sending us bills that don't make any sense. And as you pointed out, millennials are the largest proportion of the population. Like just by sheer mass, they're going to force change.
Yeah, new products are gonna change that. Let me just talk about something completely unrelated to healthcare, just to sort of make a point. So I'm into mixed martial arts. Okay, I watch UFC and a bunch of other leagues nobody's ever heard of. Right, UFC out of nowhere this week announced that they are moving all their pay-per-views. Okay, their pay-per-view is like massive business. They're moving all their pay-per-views to ESPN Plus. Like all of them.
So instead of being a pay-per-view on each event, you're now paying, was it $6 or $7 a month?
No. You're paying that plus you're paying the pay-per-view fee, and they're going to drop the pay-per-view fee.
Got it. Okay.
My point is channel. A, they're going exclusive. B, it's all streaming. It's all internet. There's no more buying it through DirecTV. There's no more buying it through Comcast, Xfinity. There's no more buying it through Cox Cable. There's no more buying it through Time Warner. It's 100% streaming through ESPN Plus. So you can watch it on your app. You can watch it on your tablet. You can watch it on your Roku TV, your Apple TV. You can watch it on any of those devices, but you will not be able to watch it via a cable provider, right? UFC is the fastest growing sport in the world right now. People don't know that. Mixed martial arts via the UFC is the fastest growing sport in the world right now. And they're taking the premium product, the pay-per-view product, and they're moving it 100% to streaming on a single channel. Now, there's been all sorts of outcries about, this is terrible, blah, blah, blah. I can't get it on this. I can't get it on that. They're not stupid. They've run the numbers.
They know.
They've run the numbers.
They know.
This is where it's going, right? And so this is the kind of stuff that I think is still surprising people, right? Is like we're already in an over-the-top content world. We're all we're already here. Like it's not coming anymore, but it's all moved so fast that we can't really wrap our head around the fact that it's actually here now.
Okay, so
are you following what I'm saying?
Oh, absolutely.
Like Amazon's going to announce their healthcare business for real, not just like a website, not just a CEO, for real, and it's going to be like ready to go.
Okay, that's what I want you to do is make this absolutely crystal clear for the establishment.
They're not playing around,
what's
dude.
The
this is not a look. They're a publicly traded company. This is a big storyline. You don't create big storylines with no teeth.
Yeah.
This has teeth.
People are talking about whether or not they're going to get sued for infringement on the name Haven. Doesn't matter.
This has teeth, right? United tried to sue Amazon about Atul Gawande, lost. And United's no joke.
Yeah.
Like if anybody's a big deal in healthcare, it's United, right? So it's all going to come, period. Like I'm just not even interested in debating that anymore, right? So now it's just a matter of when, how does the legacy incumbent industry navigate that, right?
Yep.
And quite frankly, like I'm just not even interested in talking to anyone who doesn't believe that. It's like,
you have to be, you can be defensive if you want, but you're going to lose. You have to be proactive. You've got to be getting out of this.
Or maybe you're going to win, but I'm not spending time talking to you. Do you get what I'm saying? When I say I don't want to debate it, I just mean I'm not spending any time or energy on it, right? There's enough proof for me, and I think that there are enough smart leaders who recognize that change is going to happen for me to focus my time and energy there. I don't want to go into an endless debate about something that I believe is inevitable and that is really just a matter of time. And I can't possibly predict the timing because I'm not on the inside, right? I'm not at Amazon. I'm not at Alphabet. So I don't know how fast it's actually going to happen.
Which means that you're just going to work your ass off to get it done as quickly as we possibly can.
Right.
Don't worry about them.
Right. Our job at Health Further is to try to help the incumbent legacy industry figure out how to navigate and take the assets and inventory that they have and make it valuable for the future healthcare economy. That's our job. It's not to debate things, right? You know what I mean? And if there's only 5% of the industry that buys into that, then that's the 5% we need to be talking to.
Great. All right. If you want to learn more about that, go to healthfurther.com. Contact us. There's a contact page. Subscribe to the newsletter. Let us know what you think. Thanks, Marcus.
Thanks.